falling into a state of sadness, is something everyone experiences at one point or another. However, becoming a patient with clinical depression is a different matter, with perhaps around 5% to 10% of those who experience such feelings actually developing clinical depression. One of the most significant differences is that when feeling down, if you don't engage your body, it can lead in. Utilizing your body doesn't merely mean engaging in activities, but also finding pleasure in sensory experiences through those activities. Personally, I like the scent of wood, maybe oak, which is a scent that activates my own senses and enhances my mood. This kind of sensory activation can be helpful, especially when dealing with deep and inescapable pain or sorrow. You have to trust in the power of time and wait. Time inevitably brings about changes. While people who are depressed tend to use a multitude of words and terms to express their feelings. One interesting study result I included in my book suggests that those who are enveloped in depression tend to use the word "I" quite frequently. Similarly, based on my clinical experience, depressed patients tend to talk more about themselves, whereas cautious patients with bipolar disorder tend to discuss future plans or dreams more than their own current situation. This is to say that when one is feeling down, perspectives tend to gravitate inward, focusing on oneself. When in a positive mood, thoughts about the world and others expand, while during depression, those perspectives narrow, fixating more and more on oneself. This phenomenon is even referred to as egocentric bias, where focus intensifies on oneself. Furthermore, during such introspective moments, negative aspects are given more attention than positive ones. Especially, people tend to ruminate on past mistakes, regrets, and choices they believe were wrong, leading to a repetitive cycle of self-blame. These thoughts, verbalized or not, contribute to deepening one's depression and draining energy. Continuously engaging in such conversations can cause others around you to become similarly depressed. This kind of language pattern actually exacerbates depression. However, even when feeling depressed, one often feels the need to engage in such conversations, as it's a symptom. Depressive rumination is a symptom of depression. The continuous presence of these thoughts characterizes depression, and these thoughts should be approached as a signal to shift focus, rather than succumb to them. When caught in such a pattern, instead of constantly focusing on your own flaws and mistakes, it's not a healthy mindset. At such times, take it as a signal to inject some energy. To do this, it's important to assess your current state. Instead of letting yourself be consumed by these thoughts, consider if you're feeling low due to stress or burnout, or if you're simply tired. Use this as an opportunity to check your own condition. Instead of only thinking about yourself and your weaknesses, constantly coming up with ways to fix yourself, consider that these thoughts might arise due to depression. When this happens, interpret it as a signal to infuse yourself with energy. In order to revitalize yourself a bit, think about engaging in activities like exercise. Examine your condition, and instead of allowing these thoughts to persist, shift your mood and uplift yourself. This way, you might find some renewed vigor. Excluding therapeutic approaches, it's a fact of life that everyone experiences stress and sadness. Falling into a state of sadness is something everyone experiences at one point or another. However, becoming a patient with clinical depression is a different matter, with perhaps around 5% to 10% of those who experience such feelings actually developing clinical depression. One of the most significant differences is that when feeling down, if you don't engage your body, it can lead to genuine depression. Utilizing your body doesn't merely mean engaging in activity, but also finding pleasure in sensory experiences through those activities. This dual purpose of sensory activation is essential. For instance, taking a bath can be beneficial. When you're feeling low and your mind is growing cold, immersing yourself in warm water can raise your body temperature, releasing tension and offering solace. Finding comfort in scents you enjoy is also a method. Aromatherapy or just the scent of things you like can be helpful. Additionally, engaging your senses of touch is important. Shaking hands with a friend, giving a light hug, or holding hands with a family member can all activate these senses. Visual experiences are equally crucial. People often recommend spending more time in nature and looking at greenery to relieve stress. In reality, one of the most effective ways to heal when stressed is to connect with nature. Natural surroundings provide a significant source of comfort, especially the soothing effects of greenery. Visual comforts can help ease our minds, and those who have been able to experience nature up close after surgery tend to heal faster than patients confined to windowless rooms. Being close to nature and immersing oneself in the green environment can have healing properties. Activating these sensory experiences can lead to personal growth and help overcome feelings of depression. This is the second important method for escaping from a state of melancholy, using the body's natural abilities to activate these senses. Another important factor is time. There are moments when personal efforts may not be enough to change one's mood. No matter how much we exercise, socialize with friends, or seek professional therapy, healing the mind often requires its own time. For example, during times of loss or separation from loved ones, the process of healing necessitates a quiet period. Textbooks often suggest a time frame, like saying grief may take around 6 months. But reality shows that it might take a year, 2 years, or even longer. Rushing time won't help. It's important to patiently allow oneself to heal. Intense sorrow and major losses demand a prolonged period of time for recovery. After this period, adaptation occurs, and people invariably discover changes in themselves. Thus, it's essential to have faith in the power of time. Pushing time or blaming oneself for not recovering quickly doesn't yield positive results. Trusting in time is crucial because it has the ability to change us, heal us, and help us adapt. Despite feeling utterly unable to cope with a situation, adaptation eventually comes, and personal growth follows. Even if one initially believes a situation to be unbearable, with time and adaptation, a person can transform and adjust. There are harmful thought patterns that hinder growth and exacerbate mental anguish. Categorizing thoughts along the time axis reveals two types of harmful habits: dwelling on the past and fixating on an imagined future. Reflecting on the past can lead to melancholic rumination, which does not uplift mood or infuse vitality. Similarly, excessive worry about an unrealized future can lead to anxiety. Anxious thoughts often involve imagining the worst outcomes for minor or insignificant situations, causing unrest. It's important to focus on the present and immerse oneself fully in current activities, concentrating on what one can do in the moment. And practicing mindfulness are essential steps towards maintaining mental well-being.